I would say that we are living a period where genetics really is counting. You know, the number of new mutations, new genes associated with all diseases, it's amazing. And in some way, doctors are facing a scenario where we need to know how to fit everything that we knew before with this new knowledge. And in fact, it's what is happening is that we are finding that genes cause, you know, the old diseases, but the diseases are different from what we thought in the past. So the phenotype, the clinical characteristics that were originally described now have enlarged. And in some way, this is even questioning the way we have classified, you know, the disease that we are obliged to deal in our routine. So this is clearly one of the fields where I would say we need to be very attentive. The other thing, it's like a rediscovery of disease that we are following regarding new problems. You know, I will give you an example of Parkinson's disease. We were used to look to the disease as a motor disease. Now it's what counts, it's the non-motor aspects, you know, fatigue, sleep, pain, that were already there, but for no clear reason, you know, physicians were not attentive enough to, you know, to clearly give the relevancy that they really deserve. And we are even finding that they are probably the most disabling aspects of the disease. So it's a little surprising. The other thing that I think it's happening, it's that the non-pharmacological interventions are gaining relevancy. Also because we are facing a problem that is we don't have many new drugs to treat the disease that we are, you know, that we have to deal. So in some way, we are also rediscovering things like physiotherapy, exercise, you know, everything related with allied health professional interventions, multidisciplinary care. All those aspects clearly are gaining relevancy, and when we cross our eyes to the posters and the presentations, clearly it's obvious that they are gaining relevancy, that it's well deserved. I would say that we are living ahead of a cycle, and we are entering in a new cycle. So it's crossing this transition per se, I think it's interesting. What I think will come, it's in some way new treatments for diseases will come with probably with different mechanisms, you know, targeting different mechanisms. So it's already happening, you know, some of the genetic treatments that were still, you know, scientific fiction till very recently are now coming to practice, coming to patients, and also being licensed. So in some ways still, I would say, very weak in terms of changing care, but I would say that in the next 2 or 3 years we will have a large number of clinical trials being conducted with clearly novel interventions. On the other hand, it's the way we will look to the disease, I think, will change. You know, the patients will be much more interventive. The way that we define, you know, benefit probably will change. So clearly, this is like in society, you know, we are living a moment of crisis. Crisis, it's painful, but it can be also, again, force a change. And I would probably say that in the next 5 years, 2 to 5 years, the way we are measuring benefit, we are measuring, you know, safety of interventions, the way we are approaching care will change. It's interesting that the topic of this Congress is outcomes. And really in the Netherlands, there is a huge, again, tradition of good science regarding, you know, these scientific aspects. And I think it's really interesting that we are having this Congress here, because this will be probably one of the areas where things will change more. I would say that clearly neurogenetics, it's again what is leading now, but I would also say that things related with care that came from non-traditional specialities, and the traditional specialty, it's neurology, meaning doctors, will gain relevancy. So I would say that we should look at to these two. So it's molecular genetics in one side, and very, I would say, very care-related aspects regarding the way we approach patients may be an interesting field to cover.